Hey folks, this is the day after my Achilles heel surgery. Just doing a follow-up. The procedure went well. Florida Orthopedic Institute does a great job in Temple Terrace if you're looking for someplace in Tampa. Um, the process of checking in went smooth. They did put a nerve block in my knee, so from my knee down has felt pretty good. Actually, I haven't been able to feel it all or even move my toes since yesterday. It is now 10 o'clock in the morning, which is exactly about 24 hours after the surgery. The nerve block is starting to wear off. I can feel the pain coming. I've been able to not really take the Oxycontin or oxycodone that was given to me. I also have an aspirin as a blood thinner to help their chances of getting a blood clot, and also an anti-nausea, but that doesn't seem to have any, I don't seem to need that at all. I'm not nauseous for any reason at this point. I have an order to not put any pressure on my foot whatsoever, so no walking in the boot. So that is a bit of an adjustment to hobble to the restroom and things of that nature. And I laid in bed yesterday, basically passed out because I woke up at like 2:50 the morning of the surgery and just couldn't sleep. So got a good long nap yesterday, had a good appetite, and now I'm actually in my living room starting to work. But as the pain increases in my ankle, then I'm having to take more oxycodone today. So I'm trying to step it up in quarter doses, and my dose is 2 pills every 4 to 6 hours. So I'm taking half of one pill to see how that works. So hopefully I can stay coherent for longer periods of time. But it's all going to be reflective of the pain in my ankle. I would say right now, 24 hours after, it's probably like a 4 on a scale of 1 to 10. I'm hoping to, slowly step up the medicine to keep it about that, but I also think it's going to put me to sleep. So I'm trying to get the work done. And just so you can kind of see my setup, got my laptop, got my boot, got my TV, and then down there is the cooler, which I highly recommend. You really just wouldn't be able to put ice bags on your leg effectively if you didn't have that cooling machine. And you can see it just feeds a tube that circulates water through the boot, which they put a sleeve on during the after the surgery, and then wrapped it all up for me, so it's all nice and secured. And my next follow up is in about another 7 days. So I'll check back in a day or so, or maybe even later today if the pain gets intense, and kind of give you guys an update. Hope things are going well for you if you've got the same problem.